Hypertension. If you remember, hypertension is a chronically elevated blood pressure. Now, exercise causes our blood pressure to go up and to go down as a response. You're increasing the rate at which your heart is beating, and you're increasing the amount of blood that is being pumped into the body's arteries. So right there, you're already bumping up your systolic number. And so someone with an already elevated blood pressure could potentially reach a dangerous area for them. But blood pressure is positively affected by exercise, by continuous exercise. So it's definitely something that someone wants to include, and continuous exercise over a period of time can help someone with hypertension no longer have to take their hypertensive medication. So quick tidbit to motivate: someone that is hypertensive is 3 to 4 times more likely to develop heart disease and 7 times more likely to have a stroke. That motivates me right there. Anyway, special guidelines, special things you need to consider with someone that is hypertensive: Valsalva maneuver. Don't hold the breath. You don't want that spike in blood pressure. Also, some of the medications that are taken to control blood pressure will also affect the heart rate, and so you don't want to rely on heart rate ranges. The RPE scale is much more effective because the medications that they're taking will not allow them to elevate their heart rate over a certain amount. Have your client monitor you of changes in medications, and make sure that everything flows from warm up into a conditioning phase to a cool down. No abrupt stops and starts. Exercise prescription for hypertension: low to moderate. Low to moderate intensity. Remember, you want to use the RPE because medications could be a factor. Frequency is 4 to 7 days per week. Always 4. Lower end for the beginner, the higher number for advanced. 30 to 60 minutes. We've got a 5 to 10 minute warm up, 5 to 10 minute cool down, and aerobic exercise benefits the most. The reason for that: strength training tends to be a little bit more higher intense. Start and stop. You're looking at a rep of hard, rest, hard, rest. So aerobic activity, kind of some fluid toning could be helpful. Diabetes. With risk factors, you learned about type 1 and type 2 diabetes. You need to approach the two similarly and differently from each other. So the two types with type 1, that is someone whose pancreas no longer is able to produce and secrete insulin. That person is insulin dependent, and so based on how they eat their food, they can control their body's blood sugar levels. If they are eating something that raises their blood sugar up too much, then they need to inject insulin to bring it back down. Now, a type 2 diabetic is someone that has grown insulin insensitive over time. So their pancreas is secreting insulin, but they are no longer receptive to it, so it's not lowering their blood sugar levels. And eventually, because their pancreas is secreting insulin, it can eventually quit on itself, and so that person then becomes insulin dependent as well. Now, the benefits of exercise to type 1 and type 2 diabetes: you've got circulation issues that are a part of diabetes, and this can help improve circulation, elevating the heart rate, moving in fluids in and out, a decreased risk of coronary artery disease, decreased weight and depression, and an improvement in how they feel. Now, there's a lot of guidelines regarding diabetes, and a lot of these have to do with the link between type 2 diabetes and obesity, and they also have to do with the type 1 diabetics and timing of food and insulin. So depending on the type of diabetes that your client may have, be familiar with the specific guidelines that involve that type. All right, so for type 1 diabetics, again, are insulin dependent. We want low to high intensity. That's vague, I know, but they are able to work at any different level. The one thing they need to know is how to control their glucose levels, because a high intensity is going to eat up more of their carbohydrates, and so they're going to need to supplement more with that. Now they have to be careful how they supplement their carbohydrates, because they don't have the insulin, they don't have the pancreas to be able to secrete insulin if they get too much in there. So low to high, 7 days a week, 20 to 30 minutes, and aerobic activity. Strength is not always recommended with a type 1 diabetic because of the higher intensities associated with lifting. And type 2 diabetics, we've got a low intensity recommendation, and this is typically linked to the obesity correlation between this. Frequency, 5 to 7 days, not as important, but if you look, the time is considerably longer in the type 2 diabetic than it is in the type 1, because this person isn't necessarily out of insulin. Their timing of food isn't going to be as imperative as the type 1. And of course, aerobic is recommended as the type because of cardiovascular disease, of obesity, of potential arthritis. So, like I said, they're similar and different, similar disease states, but please know the difference between them. Asthma. Asthma is a respiratory disorder. It's characterized by shortness of breath, coughing, wheezing. With someone with asthma, it's higher intensity exercises that are going to initiate some sort of a respiratory attack. So this could be caused by allergies, it could be caused by the environment, or some sort of an infection. There are a lot of guidelines that are listed here that are extremely specific to asthma, mainly dealing with the application of medicines and environment. So just be familiar with types of exercises that are not recommended. Anything that involves a lot of arm movement, because that tends to restrict the ability of the lungs to expand. It also can elevate the intensity when you incorporate arms with legs. Exercise prescription for asthma is low intensity, 3 to 4 days a week, with a warm-up of at least 10 minutes. Not 5 to 10, this is 10 plus minutes for asthma. A cool down of 10 plus minutes. You really need to control the respiratory system in this, and 20 to 45 minutes total of the conditioning phase. And the types, aerobic, low impact, upper body exercise, again, is not indicated. Coronary artery disease. Coronary arteries are the arteries that supply the heart muscle with its blood. Different than cardiovascular disease, that is our heart and our lungs and how they work together. Now, we've heard the words atherosclerosis mentioned in the media, and atherosclerosis is a buildup of plaque in the arteries, and a buildup of plaque in the coronary arteries can cut off blood supply to the heart, and just like any part of our body, if it's not receiving blood with glucose, with oxygen in it, it's not going to be able to function. What also happens, in addition to this buildup of plaque, the blockage, the artery, the lining of the artery itself becomes hardened, and it's not able to expand, it's not as fluid, and as it hardens, it's able to pick up more things, fatty deposits, cholesterols, and is not able to clean itself out, so leading to the blockage and the cutoff of the blood supply. Now, risk factors for coronary artery disease are high cholesterol, smoking, high blood pressure, diabetes, and in addition to that, we also can be gender. Males are more, coronary artery disease is more prevalent among males, and individuals above 60 for men, 65 for women. Also, obesity and a sedentary lifestyle are risk factors. Now, the exercise prescription for coronary artery disease is low intensity. We are talking about the heart, so we do not want to challenge it too greatly while trying to improve it. So if someone is in their coronary artery disease, you want to look at a low or 9 to 14 on the RPE scale, so 40 to 50 heart rates. Remember, someone that has coronary arteries could also have hypertension, and medications can affect their heart rate, so RPE can usually be the better choice to measure intensity. 3 to 5 days a week, 20 to 30 minutes. Pretty much your warm up, your cool down are your workout. So we don't have it broken down as specifically as we do, because your intensity is going to pretty much remain a warm up intensity. And aerobic, low impact exercises are suggested, and especially please avoid Valsalva maneuver exercises, heavy weights, or isometric contractions.